Hypertension, what is it? Why is it dangerous? So hypertension is a diagnosis when you have chronically elevated blood pressure according to a certain number of rules. We like to use 120/80 classically. So if you're up above that on a regular basis, then you have the diagnosis of hypertension and you're like, well, what's the big deal? I don't feel this blood pressure, it's fine. Well, the risk is it increases your risk of dead brain, stroke, dead heart attack. So that's one of the biggest things we worry about with blood pressure. So blood pressure is what your arteries are, it's like the wall or the resistance of your arteries that your heart works against. And so if your arteries are squeezing down too much, and there's various reasons why you could have high blood pressure that I'm not going to fit in a 2-minute video, but the idea is if you do have high blood pressure, how will you know that? So this goes back to that perception and perspective issue. You can feel like your blood pressure is normal, but we need some data points to correlate. And here's the truth about high blood pressure or hypertension is you won't feel it until it's too high and you're at super high risk. So if you're just running barely above 120/80, let's say you're chronically at 140 and over 95, you won't feel that and you're doing damage to your body if you're chronically between the 140s and 150s for that top number, but you won't feel it unless you get some data points to prove that you are there. So you don't know. And that's the whole point of perception versus perspective. We can feel, see, hear, that's our perception. That's why there's a word called misperception, but we need to gain perspective. We need third-party data to lock in the diagnosis so that we can have better health. And that's a universal truth in anything that we do, right? You always want to have a little bit of subjectivity validated with some objective markers. I hope that helps about high blood pressure. I'll see you at the next video. Tubby Doc out.